What is lifestyle medicine? It's an evidence-based approach that really takes into account what kind of lifestyle factors does that client currently engage in. Are they engaging in lifestyle practices that moves them in the direction of positive health? Or is that client engaging in lifestyle practices that are eroding their health? We're sleep deprived. Many people are working more. They're more stressed. They have unbalanced diets. Maybe they're racing from meeting to meeting and they're skipping meals, or they're running to the vending machine or going through the drive-through and eating on the go. And all of these things, if you look at this research, contribute to more chronic low-grade inflammation in the body. It can adversely impact our immune system and really play a role in poor brain health and poor mental health. Is mental illness getting better worldwide? By all accounts, absolutely not. There are statistics showing that the rates of mental illness are going up in the United States and around the world.
Welcome to the Managing Mental Health podcast. Join us as we talk to leading psychologists about all areas of mental health, and we hear from real people that have experienced real struggles with mental health issues who can now share hope and encouragement for us all. I'm Jamie, social psychologist, author, and trauma recovery coach. We made it. This is episode 6 in our 6-part series on executive functioning. Thank you all for joining us, and I hope you've learned a lot. If you missed anything, please go back and check out the previous episodes. There's a lot of good stuff to learn about this issue of executive functioning, and I think you'll start seeing how important it is in our daily lives, regardless of what issues we're talking about. We talked about executive functioning, what it's responsible for, some important clinical and forensic considerations, some things that cause executive dysfunction. We also learned about the implications for physical health, and we talked about the neuroscience behind it all and the idea of self-regulation. So we're back today with our special guest, Dr. Jared Brown. Welcome back, Dr. Brown.
Thank you, my friend, for having me.
Glad to see you again. Today, we're going to discuss an area of executive functioning, but in terms of healthy lifestyle practices and this idea of lifestyle medicine, which kind of sounds obvious, but I have a feeling it's probably deeper than what we think. So why is it really important for us to think of this concept in terms of executive functioning?
I have a certification in lifestyle medicine, and once you really learn this field, I really believe it can be applied to any setting if you have the right training, because a lot of it's just good common sense. But if you are interested in enhancing your mental well-being, and I know your podcast focuses on lots to do with mental health. So if somebody wants to improve their overall psychological functioning, their mood state, they just want to feel better, I do think lifestyle medicine can provide some insights into that. When we think about well-being, mental well-being, think about subjective well-being. That's another area that I would recommend your audience to at least have a basic understanding of. So when we think about subjective well-being, do we have good knowledge of our current health status? Do we have good health literacy? Do we know how to cook food, how to read labels? What kind of medications are we taking? Why are we taking those medications? Can we ask good follow-up questions to our healthcare provider? Or is it maybe a client that has very low health literacy and they just go with the flow? They have no idea why they're taking the meds they take. They never ask follow-up questions. They're confused a lot. They don't understand the importance of going to a dentist. They don't understand the importance of good, healthy eating. Subjective well-being has a lot to do with physical activity, your social support status, avoiding harmful habits like smoking cigarettes, overeating right before bed. Lifestyle medicine plays into that, and we'll talk about that in a minute. Another variable I think it's important for all of us to be aware of, and there's a lot of research literature out here on this, about our modern lifestyle. That may sound like a good thing, but our modern way of living in the United States and around the world in many places is not moving in the right direction of health. So if you look at this research on modern lifestyle habits, what do we know? What do we found? We're sleep deprived. Many people are working more. They're more stressed. They have unbalanced diets. Maybe they're racing from meeting to meeting and they're skipping meals, or they're running to the vending machine or going through the drive-through and eating on the go. And all of these things, if you look at this research, contribute to more chronic low-grade inflammation in the body. It can adversely impact our immune system and really play a role in poor brain health and poor mental health. And when we think about our modern lifestyle, elevated levels of stress are everywhere. How many people do you know you look around and they're just stressed out from a variety of reasons? Could be financial, it could be from trying to maintain multiple jobs, parenting stressors. So, stress has a lot to do with this. And unfortunately, too, when we think about all these things, is mental illness getting better worldwide? By all accounts, absolutely not. There are statistics showing that the rates of mental illness are going up in the United States and around the world. Why do we want to care about tackling mental illness? Well, it's the right thing to do, but if we just look at it from a cost standpoint, there are some statistics that show that untreated mental illness and some of the factors associated with that may impact the global economy by trillions of dollars. So it had huge financial implications as well. Why do we want to care about this topic within the context of working with clients with very serious mental health issues? Well, what we've learned in this series is that if you're working with clients with very serious mental health challenges, a lot of times they're going to be dealing with executive function impairments. That can trickle down into contributing to poor health outcomes. And if you look at this research, people with very serious mental health challenges, and if it's gone on for year after year, decade after decade, and they haven't had the right supports and services in place, unfortunately, that person may pass away 10 to 20 years sooner than the general population. Obesity is higher in this population. Cardiovascular disease risk factors are higher. Sleep issues are higher. Poor dietary practices are higher. All over the map. Lots of things to consider. Jamie, before I get into the heart of today with lifestyle medicine, any thoughts you want me to go a little bit deeper into with any of that?
No, I think that makes a lot of sense. And I actually think it's something, thankfully, that we've seen more prominent in the past few years in terms of not just physical health, but mental health. And that's the idea of what you're talking about in terms of healthy lifestyle practices. I think there's a lot of questions, and we probably will come back to some of them. But I I think maybe, and especially in the U.S. and probably other Western societies, that we've relied a little too much on what we're told. Especially you go into the grocery store to pick out something to eat, you go to the shelf and you grab a can of something or a box of something, and we kind of naively assume that, okay, well, this looks like it would be good food, so we buy it. And in reality, it's not. A lot of it's full of chemicals that are dangerous to us. A lot of it's full of just dead carbohydrates and things that have no actual nutritional value. And then the same in terms of medicine. I think we go in trusting that what we're told and what we're given is going to be in our best interests, and sometimes that's just not the case. It always surprises me if you hear a commercial on TV or the radio for a drug, they start listing the side effects, and there's 32 side effects for this one thing that it's supposed to treat. And that just can't be healthy long term. And it just, there's just so many aspects of this that I think we've just taken for granted for too long. And we're seeing, like you said, we're seeing the results of it because physical and mental health issues keep rising. And so we need to take more responsibility individually for our own health and do the research and learn what it means to take care of ourselves.
And physical and mental health also erode brain health. They're all
Mhm.
interconnected. So
Mhm.
if one is off, it's probably adversely impacting the other. So you can't just target, in my opinion, the client's emotional mental health without considering the fact that maybe there's some gut health going on issues, or there's some sleep issues, or there's some dietary things. And we have to also take into account when, like, maybe you're a therapist listening to this, you really want to target mental health and you're working with the client's healthcare provider collaboratively, excellent. But also, are you taking into account their brain health, their executive function capabilities, their self-regulation abilities? We've talked about working memory and inhibition and cognitive flexibility and metacognition. If you don't take those into account during the treatment of a client with mental health, drug problems, substance use issues, or if you're a doctor listening to this, you're treating the healthcare side of this. If you miss those parts, those go to the heart of goal planning and goal achievement. So if your client is always forgetful, they're always scatterbrained, they just don't show up on time, and they talk a really good game for you, but then they leave your office and they come back the next week or in a month or two and they've not achieved anything. Could it be an executive function problem where that client needs some coaching, modeling, teaching, some other healthy lifestyle habits that need to be reinforced outside of your office and getting that client some in-home support? The answer is probably yes in a lot of cases. And I do believe lifestyle medicine can help with this. Again, what is lifestyle medicine? So it's common sense, but if you look at this research, it's an evidence-based approach that really takes into account what kind of lifestyle factors does that client currently engage in. Are they engaging in lifestyle practices that moves them in the direction of positive health? Or is that client engaging in lifestyle practices that are eroding their health? So, for example, what are things that erode people's health? Well, sedentary behaviors, we talked a lot about that as well. What about tobacco use? What about excessive screen time exposure? Those are all things we've talked about. Those are lifestyle habits, not good habits. And the research is very, very clear on this. If somebody really has an appreciation for lifestyle medicine, they're working with providers who understand this topic, have the proper credentials, it can play a role in preventing some chronic diseases. It can absolutely play a role in managing chronic diseases. And in some cases, I'm not making promises, but in some cases, it may play a role in reversing some chronic diseases. So, breaking it down a little bit further, there are 6 pillars of lifestyle medicine. They're all very, very common sense. The 6 pillars are, and they're really in no particular order: physical activity, getting people moving more. I'm not saying going on running a marathon or becoming an ultra weightlifter. Getting moving more, walking, whatever it is. The avoidance of harmful and risky substances. In this literature, lifestyle medicine, it talks a lot about like drugs, alcohol, tobacco products. But I would add to the list excessive sugar. Could excessive screen time exposure be something to consider under that umbrella? It's not really a healthy or unhealthy substance per se, but too much of that would be something you'd want to look into. Another pillar, stress management. If we can learn skills to manage our stress. We know stress is a killer. It's a driver for many, many diseases. I'm not saying somebody that has stress about taking a test or getting married, having a child, not things like that. I'm more talking about chronic stress. Maybe someone's in a domestic violence relationship for many, many years. The person just lost their job. They have kids. They're going hungry. They're going to be homeless. Those kind of stressors, really chronic toxic stress. Nutrition, another pillar of lifestyle medicine. Eating good food, but also understanding meal timing, breakfast skipping literature, Mediterranean diet versus the Western diet. I'm not advocating for any particular diet, but just learning about nutrition. Another pillar is promoting positive social connection. If you are one that doesn't have any friends, you're isolated, you're lonely, maybe someone has social cognition deficits and they struggle with social skills and friendship making, that's an area to target. And the sixth pillar is sleep, getting good restorative sleep. Those are the six pillars of lifestyle medicine. So, Jamie, all of that, very common sense. There's no rocket science there. But how often do traditional healthcare providers, when you go into your primary healthcare doctor, ask questions about all of them and really screen for that? Not with any experience I've ever had going to the doctor. Maybe they'll ask you a question about your sleep, but how often do they ask about your social connections? All those things. Not that much. And one wonderful resource that I would recommend people being aware of, if you're really wanting to learn more about lifestyle medicine and looking at different resources, just Google American Board of Lifestyle Medicine. That's more geared toward medical doctors, but there is more emerging research showing that lifestyle medicine can be applied to drug and alcohol treatment programs, mental health settings. I just gave a talk on this to a different group recently on how we can apply these principles to the criminal justice arena. So again, they can absolutely be applied to so many things. And it's tough to know what the actual statistics are, but I've seen statistics out there, and I don't want to get hung up on the actual numbers, but there are some statistics that point to the fact that chronic diseases, I know 70%, 60% of chronic diseases in our country, in the United States, may be partially related to how we live our life. So we know genetics plays a huge role, but again, what we do throughout life and even early in life really makes a difference several decades later. And so we have the six pillars. We got that defined. We have lifestyle medicine defined. Why do I like this field as well? Well, if you look at this research, lifestyle medicine borrows from or is complemented by a number of other fields of study. And some of the main fields of study that are talked about in this literature is health and wellness coaching is one. So maybe you're not a therapist, but maybe you're a coach. Maybe you're a exercise physiologist, whatever role you play. Coaching, modeling, teaching, role playing is a great skill set to have when you want to move in the direction of becoming lifestyle medicine informed. Lifestyle medicine also borrows from nutritional science, sleep medicine, positive psychology, addiction medicine, behavioral change literature, and exercise science, to name a few. So it's a very holistic approach, borrowing from all kinds of really helpful interventions. So, Jamie, I can go a lot deeper into the basics, but wanted to stop there for a minute. See if any thoughts.
Yeah, in terms of medical or clinical providers, do you think, or have you seen where it's been more effective for them to try to incorporate all of these into their practice and their services, or to have more collaboration with other providers that do?
My response, best response that I can think of is that most providers aren't going to have an expertise in every one of the 6 pillars. But if you know the basics and you infuse those questions into your intake and screening process, and you start identifying clients with issues in those 6 pillars, you might be able to maybe you have expertise in all 6, but maybe you can tackle 4 out of the 6 through your lens. Collaborate with somebody else. Maybe collaborate with a nutritionist, dietitian. Collaborate with sleep doctors, sleep psychologists. Maybe it is you're doing telehealth. You're not getting the connected, you're not doing groups per se. So maybe you're just doing one-on-one, which is phenomenal. But maybe that client would also do well because of the social piece, getting connected to a social group. And social groups don't have to be done face to face. I've consulted on cases, especially during the heart of COVID. There were many people that got connected to social groups online, including a couple people I know got connected to some online yoga groups, exercise groups. So referral out to other providers, I think, is a great thing. Being okay saying, I can't do everything. I need to work with other people, pulling other people in, forming that multidisciplinary team. It makes it more well-rounded. It makes it more holistic. But the more you as a provider can get training in lifestyle medicine, understand the different research findings, applications, terms, and principles, and infusing at least the basics into the work you do, you'll be moving in that direction, becoming lifestyle medicine informed. And that will trickle down, I hope, into helping improve client outcomes. So if you're a provider and you're only focusing on the mental health side of things and not asking your clients about their dietary practices, their sleep habits, maybe you have one question about it that probably doesn't get a deep understanding of what's going on with your client. Get comfortable asking those questions. You're not out there diagnosing a sleep disorder per se. You want to be careful not getting in the lane of a dietitian or nutritionist, but I don't see any harm in asking your clients general questions. Okay, tell me what you ate today. Do you have a tendency to skip breakfast? Where do you go usually for your food? If you hear patterns, well, I only go through the drive-through every day for lunch. The only place I ever go to eat is the gas station across the street from my house because I don't have a car, and that's the only food available. Food insecurity is a huge topic you'd want to screen for as well. I'm not sleeping well. I wake up with a headache every morning. My bed partner always says I'm snoring. Well, maybe a referral to a sleep specialist, rule out sleep apnea. So little things like that, getting comfortable with just those basic red flag indicators, I think still keeps you in your lane and you're not veering off into the lane of a nutritionist, dietitian, medical doctor per se. So that
Okay.
would be my thoughts.
Yeah, that's a good way to look at it. At any provider, whether it's medical, whether it's clinical, therapeutic, can at least ask the basics and make some recommendations, referrals. Definitely take the time in advance, be a little proactive and say, okay, what connections do I have in the community or can I make in the community so that I can make referrals, like yoga classes, like yoga instructors, you know, dietitians, nutritionists, things like that. Okay, good, good.
One thing
There's
you triggered me on, Jamie, if I just
Yeah.
say something, when you said that, another term all of you should probably learn about is social prescribing. That's a movement in the medical arena. There's an organization, I think on the national level, might even be on the international level if you Google social prescribing. It's a movement in the medical field, but I don't see why the mental health arena couldn't borrow from this. Is medical doctors, healthcare providers who look through the lens of social prescribing would be, I go into my doctor knows or is picking up on cues. I'm really struggling with my mental health. I'm struggling with loneliness. Social prescribing would mean that doctor prescribes a knitting class, a swimming class, a dance class, a yoga class, whatever it is. They're prescribing not just maybe a medication. They don't go right to the med, but they're going to these other things. And there's great research on all of those things. And I think some of that ties in very nicely to our neuroplasticity talk. So a doctor who really appreciates social prescribing literature is going to recognize the benefit of maybe that client. Maybe let's not go with the med right now. Maybe they're just lonely. They need a group. And that doctor knows of a group that they could refer and actually like prescribe a dance class or a group singing class. And there's cool literature on that in the mental health arena showing that clients who go to those classes, what happens? They're happier, they're healthier, their mental health symptoms go down. I mean, or are you sitting at home and you're lonely and isolated, and your only connection to the outside world is being on the internet, and you're on the internet all day long, all night, and you're forgoing your sleep? So social prescribing is another great tool that I think it would be helpful for the mental health arena to maybe start looking into, and how you could borrow from that or how you could learn from that as well.
Yeah, that's awesome. I hadn't heard of that term, but it definitely makes sense. And I think that would be one of those areas where physicians, therapists could, do a little homework and make that a part of their toolbox for when people come in and they talk about these issues. Then they could have a few different local resources available and do that. That's really awesome. I like that. Okay. What are some of the deeper considerations then in terms of the lifestyle medicine?
This isn't necessarily lifestyle medicine topic, but it is. Life's Essential 8. I often talk about that when I give talks on this to professional groups. Have you ever heard of the Life's Essential 8?
Life's Essential 8 is in the
Yeah.
number?
Yep.
No.
Yeah, most people, when I say that, no, I haven't heard of that. But when I say what it is, you absolutely will know. So Life's Essential 8, it's just a set of health factors and behaviors that are really, really important for managing our cardiovascular health. And it's put out by the American Heart Association. It's very common sense. So Life's Essential 8, number one, blood pressure control, weight management control, managing our blood lipid levels, eating healthy, physical activity, quit smoking, get good sleep, and managing our blood sugar levels. How many of them tie into lifestyle medicine? Most, if not all. So Life's Essential 8, I just introduce people to because it's very common sense. Why do you want to care about your heart health? Well, what's good for the heart's good for the brain. What's good for the brain is good for the heart. So you want to support both simultaneously. In this series, obviously, it's been focused on executive function. What are the things that can erode our cognitive brain health? Again, what we eat, or even the lack thereof, if we're talking food insecurity, malnutrition. Hormones can play a factor. Our lifestyle habits, which is what we're kind of talking about today. Genetic factors, we haven't really got into that. That's a whole nother can of worms. Certain biological processes that might be going on in the body. So you'd want to learn about biological despair. Probably a little bit on telomere health, inflammation, blood sugar imbalances, the gut microbiome, and then what's our current health status like? Is that person dealing with chronic health conditions, but maybe they're not taking them seriously? I know a lot of people, unfortunately, that have sleep apnea. They don't like their CPAP machine. They don't bother with it. I know a lot of people with type 2 diabetes. When I see them eat, I'm like, you have type 2 diabetes. Why are you doing that? And they have huge amounts of food, huge amounts of sugar. So we all probably know people like that. I've had family members like that, and I've had some family members die, I think, as a result of not taking their health condition seriously. Or maybe it's a client that's low functioning. They want to take it seriously, but they don't have the tools, resources, or the cognitive capacity to really connect the dots and appreciate those things. So equally important for clients like that to have a really good team, caregivers, professionals, all of those things can play a role. Other things I think too, a couple things we'd want to be aware of when we're thinking about these things, which I spoke about briefly, I think earlier on, but health coaching. That would be something we'd want to consider. I think health coaching literature pairs very nicely with lifestyle medicine. Why do I say that? Well, health coaching, you don't have to be a therapist, psychologist, whatever role you play. Health coaching is kind of what it sounds, coaching, modeling, teaching, role playing. I think it ties in nicely with psychoeducation. It ties in nicely with psychiatric rehabilitation. And the benefits associated with having a health coaching lens, the research says, it can really help clients improve self reflection. That's a great skill to have because if we continue to make mistakes, self reflection can help us make changes. Motivation can be enhanced with a health coaching lens. How many people do we know in our lives that maybe have a New Year's resolution? I'm going to eat better. I'm going to quit smoking. I'm going to go for walks every day. And how soon does that motivation kind of go away? Again, there's a lot of reasons there. Motivation, executive function go hand in hand, but motivation can be eroded by all kinds of things too: depression, fear, trauma, sleep issues. Health coaching can help build confidence. Health coaching has been associated with having higher levels of self regulation, which tied in nicely to the talk we had recently. Health coaching approaches can increase positivity in your clients. Why do we want to care about that? Well, the health benefits of engaging in positive thinking consistently are going to help you live longer. It's going to help your brain. It's a protective factor. It's going to protect your heart. Do you know a lot of people in your life right now who wake up every day just angry and they're hostile and they're irritable? What does that do to their body? It's not good, the research says. An antidote for that: self compassion, promoting self esteem, being kind, motivational interviewing, trauma informed care. All of those things can be very, very helpful. So, health coaching ties in very nicely to this as well, Jamie. And there's a lot more to it than that, but I can go deeper in the weeds if you'd like.
Yeah, I think the coaching aspect is important because it often is a supplement to, you know, medical care, therapy, but it adds some extra components in terms of encouragement, like you said, motivation, um, and it's funny as human beings, we even if we know the right things to do, sometimes it takes an outside perspective that's not emotionally attached to the situation, and to be able to point out, okay, well, this needs to change, or that can change, this could go a better direction, and kind of help map those things out in a way that people can follow. And it kind of gives them some directions, even if you ask, well, do you think eating healthy is good for you? And they say, yes, of course. But let's boil this down and find out exactly what your habits have been in terms of eating and how could they be different. And okay, well, let's substitute this. Let's take this a different direction. So yeah, I think coaching is a very important tool for people to use, and it's often pretty low key. It's not someone yelling and it's not like Marine Corps, not that type
Yeah.
of instruction. It's usually a very empathetic and very uh, caring way that people can help guide, and especially considering all these different areas, like you said, the 6 pillars, and the 8, an opportunity for someone to help you look at each of those so that you're not alone and that you do have some guidance, some motivation. Okay. Um, Anything else that you think is important, or maybe any other, new research that you've seen in terms of the lifestyle medicine?
I think to end on a good positive note, another body of research that ties in beautifully to this, in my opinion, is wellness. And it's common sense, but there's many, many models that you can find related to wellness. But if you look at things through a wellness lens, like if you're doing an intake with your client or a screening session assessment, you're developing a goal plan, whatever it is, there's some good frameworks out there. And if you look at the dimensions of wellness, like everything we're talking about, there's multiple pieces of the puzzle. So pretend you're sitting with your client right now, or maybe you're listening to this and you're thinking about your own wellness. What are the dimensions of wellness you'd really want to take a look at? Well, there's physical dimensions. So we really want to, again, look at physical activity patterns, our physical health. There's intellectual dimensions. Are you someone that's a lifelong learner? Are you curious? Considering the way we learn, our thinking patterns. There's the emotional dimension. Are you someone that has some emotional problems? Are you one to get really angry? Are you one to suppress your emotions? Those would be some things in the emotional dimension lens. The social dimension, again, we talked about that today. Maybe it's empathy, it's intimacy, it's social intelligence, it's emotional intelligence, looking at all those dimensions. The spiritual dimension, and I'm not stressing either way, but looking at spirituality, is getting connected to a church body important to you? Is it not? I mean, things like that you'd want to consider. The vocational dimension, what skills do you have? Do you want to get a job? Maybe you're struggling to find a job. Maybe someone gets fired from a job over and over again. What are those barriers? The financial dimension, there's some literature in the lifestyle medicine literature that talks about digging into the client's financial health and well-being as well, because that's a huge stressor for many, many people. And then the environmental dimension, and that's a big dimension too. Where does the person live? What's going on inside their home? What's going on outside their home? And a couple other things you want to consider with the environmental dimension. Are they getting a lot of exposure to pollution? Do they live right across the street from a busy freeway or a factory? Maybe they live very close to an airport and they are constantly being woken up with airplanes taking off and landing. I mean, there's a million things to think about with the environmental dimension. So looking at it through a dimension of wellness lens and considering those 8 variables can also give a better snapshot of what's going well and what's not going well in your life or the client's life you're working with. And if you take all those moving parts into account, you can develop a good goal plan that may be able to help target those things and help your client improve their overall health and well-being. And that will trickle down into enhancing, hopefully, their brain health, executive function.
Absolutely. Yeah, that's a great way to sum it up, because all of those pieces, are important. And when they're in the right place, then they help physically, mentally, emotionally, all of those areas. And that's all a part of when we talk about holistic care, is just looking at physical, mental, emotional, social. Great, 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 great. So that wraps up our 6-part series on executive functioning. Again, if you missed any, please go back and watch the other episodes. You will get a lot out of this, I promise. And thank you, Dr. Brown, again, for sharing your wisdom and insight on this issue and the broad implications for individuals, families, and even society.
You're welcome. Thank you, Jamie, so much for having me back. And thanks for all the good work you're doing with your podcast.
Appreciate it. We will definitely have you back to discuss more topics involving mental health. And spoiler alert for those listening, we've already got at least one planned upcoming episode about neuroparenting. And if you're listening going, what the heck is neuroparenting? You're not alone. I did too the first time I heard it. I had no idea. I was like, wait a minute. What is this? What is this about? So I promise you don't want to miss that discussion. That will be coming up soon. So please subscribe, like, comment, and share. Hit the little bell for notifications to stay connected to this community of well-being as we all learn and grow together.